Welcome to ICARE, Infection Control Advocate and Resident Education. In this lesson, we will cover how limiting antibiotics but promoting vaccinations can help protect yourself and others in the nursing home community. It's a chilly winter morning at the Springville Nursing Home. Mr. and Mrs. Sanchez have been working with Julie, Springville's social worker, to help Mrs. Sanchez transition to her new nursing home community. Mrs. Sanchez is a new resident at the Springville Nursing Home and was recently diagnosed with dementia. She was also found to have C. aureus, a germ that can be very drug resistant and can cause severe illness. Fortunately, Mrs. Sanchez does not have any signs or symptoms, but since she was found to have this germ on her skin, prevention precautions are used during certain times when Mrs. Sanchez receives care. Julie worked with staff to make sure the right prevention precautions were put in place. These precautions prevent germ spread, but also do not limit Mrs. Sanchez's ability to participate in group activities and meet new people. This is great for Mrs. Sanchez because she was excited to know that the Springville Nursing Home holds a painting class every week. At this week's class, Mrs. Sanchez meets Stella Johnson, another resident. They chat a while and find they both have been affected by drug-resistant germs known as MDROs and medicines used to treat them, known as antimicrobial drugs. For Miss Johnson, she had an infection that was treated twice, the first time with the wrong antibiotic. For Mrs. Sanchez, she likely picked up the MDRO she now has on her skin from an outbreak going on at the nursing home she previously called home. Chatting and reflecting on their recent experiences, both Miss Johnson and Mrs. Sanchez wonder, what can the Springville Nursing Home do to prevent what happened to them from happening to other residents? And what can they do to protect themselves and others from bad bugs known as pathogens that can lead to inappropriate antibiotic use, MDROs, and outbreaks? After this lesson, you will be able to answer the following questions. What practices prevent the misuse of antibiotics and their consequences? What practices are promoted in nursing home residents that can protect themselves and others from pathogens? Lastly, how can being informed and involved respect resident rights while preventing and controlling infections? You have likely been prescribed an antibiotic to get rid of an infection, and after a few days, the treatment made a difference. You started to feel better and soon you recovered. There's no doubt, treatments such as antibiotics are great and have saved the lives of many people. So what's the problem? Well, you have likely heard that with antimicrobial drugs, which includes antibiotics, there can be too much of a good thing. Sometimes people can have adverse reactions to taking these medications, including allergic reactions and even toxic effects. As antimicrobial drugs are used more and more to help us stop infections, the germs that cause infections have developed ways to become resistant to the effect of these medications. And as germs develop these resistant mechanisms, they share this information with other germs through their genetic material. So, multi-drug resistant organisms, MDROs, are the result. Another negative result of using antibiotics is an increased risk of an infection called C. difficile, or C. diff for short. When we use antibiotics, we may get rid of bad bacteria, but also good bacteria we need. Without the good bacteria, C. diff has an opportunity to establish itself. This infection, which causes diarrhea, fever, loss of appetite, and stomach tenderness, can be severe, especially for older people, resulting in hospitalization and even death. Lastly, antibiotic use can lead to becoming colonized with an MDRO like Mrs. Sanchez. While those who are colonized do not have signs and symptoms, if there are any changes in their health status, for example, they get sick due to another disease and this affects their immune system, this colonization can become an infection resulting in illness from the MDRO. Both C. diff and MDROs can spread very easily in nursing home communities if the appropriate prevention precautions are not put in place. So you can see there can be some serious consequences when we use antibiotics, and so therefore we need to use them only when needed. It is important to stress that antibiotics are important and needed to treat infections commonly seen in nursing homes, including pneumonia, skin infections, and urinary tract infections. But unfortunately, at times, residents are overdiagnosed, meaning a healthcare provider believes there's an infection or disease even when a resident has no signs or symptoms at all, but bacteria are found in their bodies. For example, bacteria in the urine. This then leads to unnecessarily prescribing antibiotics to a resident. A resident can also be overtreated for an infection, meaning antibiotics are prescribed for an infection even when it's not needed. This can be using an inappropriate antibiotic that targets several kinds of bacteria, although the resident has very specific bacteria. Or prescribing an antibiotic because the resident or a family member demands an antibiotic, even if it may not be needed. Overdiagnosis and overtreatment are unfortunately common in nursing homes. Up to 3 out of 4 nursing home residents have been prescribed an antibiotic that is inappropriate or unnecessary. In order to address the misuse of antibiotics and other antimicrobial drugs, nursing homes are required to develop an antibiotic stewardship program as part of the nursing home community's infection prevention and control plan. So, what is antibiotic stewardship? The Antibiotic Stewardship Program serves to improve the prescribing of antimicrobial drugs such as antibiotics. The goal is to provide the right drug and dose for the right duration and administered in the right way. So, for example, orally versus through a person's veins. This goal helps to minimize the consequences and maximize the benefits when these treatments are needed. The Antibiotic Stewardship Program works by putting in place important improvement practices. These practices begin with having nursing home leadership committed to antibiotic stewardship, for example, by including antibiotic stewardship duties in leadership position descriptions and tasks. Accountability includes having a designated infection preventionist over antibiotic stewardship activities with input from the medical director, director of nursing, or a pharmacist that serves as a consultant to the nursing home. Having access to those with expertise on antibiotics and other antimicrobial drugs, such as a consulting pharmacist or external infectious disease consultant. The actions to improve antibiotic use must include policies and practices that improve antibiotic prescribing. Some actions include requiring those who prescribe antibiotics to clearly document dose, duration, and the reason for antibiotic use for all antibiotics prescribed. Another important action includes having nursing homes specific practices for assessing residents for infections, ordering appropriate laboratory tests for infections, and recommendations for treating infections. Nursing homes must also track how antibiotics are being prescribed and used in the nursing home community, and monitor possible common consequences of antibiotic misuse, such as rates of MDROs, C. diff, or other adverse events. The nursing home must also provide nursing home specific reports on the actions mentioned above to medical and nursing staff, especially those who prescribe antibiotics. And lastly, a nursing home should educate staff and residents regarding antibiotic stewardship. As you just learned, antimicrobial medications like antibiotics are important, as these are medications taken by residents which can affect the health status of other residents. But there's also another very important medical measure that can be taken by residents and those closest to them that can impact the health of other residents: vaccinations. Vaccinations can have a positive impact on your health and the health of those around you. It was mentioned previously in this lesson that pneumonia is a common infection seen in nursing home residents. When residents get infected with flu, strep bacteria known as pneumococcal bacteria, or COVID-19, these infections can spread to others in the nursing home community and result in pneumonia for some who become infected. Therefore, nursing homes are required to have policies and practices in place for both residents and staff immunizations. Immunization is the practice of giving a vaccination to a person. Keep in mind that nursing homes are only required to have practices and policies in place for staff related to COVID-19 immunizations, while policies and practices for residents include influenza, pneumococcal bacteria, and COVID-19. Nursing homes must offer certain vaccinations to residents and staff to promote their use. Nursing homes must screen residents to ensure they are eligible for immunizations. Education regarding the vaccine must be provided to residents and their representatives, but also staff regarding the benefits and possible side effects of vaccine. Nursing homes must document all of their activities related to immunization of residents and staff, including when the vaccine was administered and if a resident or the representative decided to accept or refuse the immunization. While the COVID-19 vaccine is required for staff who work in the nursing home, staff also have the right to request an exemption due to medical or religious reasons. Lastly, while nursing homes have requirements for flu, pneumococcal, and COVID-19 vaccines, there are many more important immunizations that are recommended for residents and staff. Please see the information sheet associated with this lesson for more information regarding recommended vaccines. So now that you know antibiotics, their benefits and possible consequences, how nursing homes promote and improve antibiotic use, and important immunizations for both residents and staff, what does that have to do with resident rights and responsibilities? All residents, those closest to them, including the nursing home community staff and administration, want high-quality care and deserve an environment that promotes high-quality care. Reaching the highest level of quality in a nursing home community includes taking all steps to prevent and control infections. And, as all nursing home communities experienced during the COVID-19 pandemic, infections occurring not only inside but also outside the nursing home community can result in changes that impact a resident's rights such as visitation and freedom to participate in activities. These changes can have a major impact on a resident's overall well-being. When nursing home communities work side by side with residents and those closest to them, such as family members, to prevent and control infections, this demonstrates a commitment to quality care that preserves and promotes resident rights. And when resident rights are protected and preserved, this also strengthens a nursing home community's ability to prevent and control infections, resulting in balanced quality care. When infections are prevented and controlled to deliver high-quality care, two major resident rights are protected: being informed and involved. Residents have the right to be informed about any medications they are being prescribed, including antibiotics. This includes the dose, duration, and the reason it is being prescribed. Residents also have the right to receive information regarding the benefits and possible side effects of any vaccinations offered by the nursing home. Residents have the right to be involved in all of their care decisions, including the decision to accept or refuse any antibiotic or vaccination. Lastly, nursing home residents have a right to be involved in the nursing home community's infection prevention and control plan. This involvement includes being provided education on infections, how they are prevented and controlled, and what the nursing home is doing to prevent and control infections. Residents have the right to provide feedback to the nursing home leadership regarding care quality concerns and have this feedback result in care quality improvement. Quality care can only be achieved when nursing homes have a strong program in place to prevent and control infections. Federal and state laws require nursing homes to have current infection control policies and procedures that include antibiotic stewardship and immunization programs, written policies for antibiotic use, monitor antibiotic use trends by those who prescribe antibiotics, and a system for feedback to those who prescribe antibiotics. Lastly, a nursing home must make certain immunizations available for administration to residents, provide education to residents and their representatives regarding immunizations, and document the education provided and the resident's decision to accept or refuse vaccination. Going back to Ms. Johnson and Mrs. Sanchez, they asked Mr. Moore, the resident council president, to add antibiotic misuse as a topic for the next resident council meeting. Susanna, Springville Nursing Home's part-time pharmacist and infection preventionist, is invited to the meeting. Susanna ensures residents are informed about the Antibiotic Stewardship program by discussing the basics regarding the program, providing handouts, and putting up posters throughout the facility. Susanna also informs residents about the vaccinations they are recommended to be up to date on using an easy-to-use chart. Susanna also asks residents to be involved in their care, to ask providers regarding antibiotics, when they should be used, or if they should be discontinued or adjusted. To help residents understand what questions to ask their providers, Susanna uses an infection assessment tool to go over common infection signs and symptoms, as well as common laboratory tests and results. Ms. Johnson continues to be very impressed with how the Springville Nursing Home works with residents to prevent and control infections. She asked Susanna if she can be more involved in the infection prevention and control plan. Specifically, how can she help her friend, Mrs. Sanchez, who was recently diagnosed with dementia, and other residents with dementia, apply infection prevention and control measures? She knows with their condition, it can be very difficult to practice infection prevention measures consistently. Susanna is very excited and welcomes Ms. Johnson's input. To get more involvement, Susanna starts a special subcommittee of the Quality Assessment and Assurance Committee with residents and family members to provide input on how to better communicate and apply infection prevention to those with dementia. This is a great process improvement project for the Springville Nursing Home. Thank you for watching this lesson. Please see the ICARE website for additional lessons, information, and support.